Welcome back to Ask Dr. Mia podcast. I am excited to talk to you all today as the first episode back from season 5. There has been a long hiatus since the last time that I recorded this podcast back in August of 2024. And right now it's in January of 2025. One of the reasons why I have taken such a long hiatus is to be a real life caregiver for my mother, who was diagnosed with ovarian cancer. And I wanted to use this opportunity to both update the audience in terms of what I have learned in my own caregiving journey, as well as new direction and continuing vision for this podcast, Ask Dr. Mia. So, in terms of updates in regards to my mom's health, unfortunately, she passed away in the middle of August, probably right around the time that I had released my last episode from 2024. And it was a difficult 2 years journey from the time when she was first diagnosed to the time when she passed away in hospice. And I know many of you are a sandwich generation caregivers where you have dependent young children that you are taking care of, as well as older adults, your parents. And I really feel like this podcast is my voice and solidarity with you all. And one of the main reasons why I decided to come back to record some more after that experience. And there are a lot of other podcasts out there in talking about aging. I hope you know that this is a podcast where we're not going to fight aging like a disease, because it is the natural progression of life as we get older. It's not something to be feared. As a board certified geriatrician, there are also other geriatric and aging related podcasts that are geared towards professionals, healthcare clinicians. And I wanted this podcast to be really intended for the lay audience, people who are not in healthcare. For too long, I think that the medical information has been gatekept from the majority of folks who might benefit from this information. And there are so few geriatricians out there. This is my way of kind of contributing to the knowledge while bringing in my own personal experience and my personal journey. So I thank you for listening, and that I hope you enjoy this mix of personal along with aging related information and knowledge in a more broad and general sense. So coming back to my mom, I had talked in previous episodes both about her diagnosis as well as how I was processing the grief of her cancer journey. One thing that, I'll go through a couple of instances where I noticed myself in interacting with her that I think probably reflects larger themes from my clinical experience and from talking with other friends who are going through similar things with their aging parents where they have serious illness. I think one theme is deciding how much to push for a certain outcome versus accepting your parents' wishes and decisions that may not be the same as your own. So for example, my mom had really wanted to explore alternative treatment options and wanted to do a lot of her own research online. As a physician, I found it very difficult to both allow and accept for her definition of research versus what the Western medical system, as well as her oncologist, have recommended in terms of cancer treatment. She really wanted, I think she was really hoping and looking for something that would both treat the cancer and have no side effects, which in my mind, I knew that was not possible. But I genuinely believe that was something that she really thought was possible. And there is just so much information online in anecdotal ways described by folks in Facebook groups talking about how certain anti-parasitic medications may be helpful in some small study, not in humans, that have shown signs of fighting cancer. And that was one particular negotiation that I needed to navigate as a advocate for my mother, but also with my particular background in medicine and speaking similar languages of medicine with her oncologist. This was not a decision that happened recently. It was probably about a year ago, which was also earlier on in the COVID pandemic course. So some of you may have heard about people using febendazole or other parasitic medications for COVID. My mom was convinced that febendazole may be helpful for her cancer, and no amount of convincing I could do could convince her to not try it. Ended up talking with her oncologist and with her, and we struck a compromise, which was to allow her to try the febendazole for a month and then measure her blood for the cancer biomarker to see if it has grown, which was a sign that her cancer has grown. And not surprisingly, it did grow in the time that we allowed for this experience, this decision that she ended up choosing to do. And I think I would have been, well, number one, no one can really convince someone else, another adult, to do something they don't want to do. And my mother was not going to choose to go for another round of chemotherapy without trying something that she was absolutely convinced would help. I think this can be something that you're struggling with in your life as well. And I think the key lesson or potential way to think about it is to give a time duration so that people are still safe from a medical perspective, but allows your loved one to be able to try something that we don't think will necessarily work. The other theme that oftentimes comes up is related to the relationship that I have with my mother and the relationship that some of the adult caregivers that I see have with their older parents before the diagnosis of a serious illness comes to play. I see a lot of folks and families dealing with dementia, and this is oftentimes get to a point where the person who has dementia is needing some significant amount of care from their kids or their spouse, and the relationship between the caregiver and the person with the serious illness have always been complex and complicated before another major serious illness is thrown into the mix. So, in my own example, I had spent about 10 years of my youth, between the age of 3 and 12, essentially living without my parents while they were getting graduate school education and then working in the United States. It was the reason why I ended up staying so long with my paternal grandparents, who really raised me during such an instrumental period of my life. And perhaps one of the reasons why I became a geriatrician. No regrets from any of that, except to say that my mom, as a parent or caregiver to a child, is very different from the parenting style of my grandparents and my paternal aunt. It was something that I had a lot of unresolved anger and um, feelings of abandonment, even before stepping into the role of a caregiver for her cancer treatment. Uh, in your own life, I'm sure you can think of instances where your relationship with either your child or your spouse or your parents that are not ideal. And those feelings can certainly come into play in the background as you are helping them navigate a serious illness. Um, as my mom enrolled in hospice and less time was left, I had been going to my own grief counseling to help me be the best daughter and the best advocate I could be, um, despite the complicated relationship that we have. And I had to think through a lot of how I wanted her to interact with me as a parent, versus what she is actually capable of doing as a parent. So, for example, I really wanted us to have a, I call it the kumbaya moment, where we talk through um, all of the past hurts and talk through how we're feeling and talk through how much she loves me and verbalize things that are very out of the normal for a first generation Chinese mother who's an immigrant in a new country. And I think this is something that we see a lot of in other immigrant parents, where the verbal expression of love is not common, and that their love language is much more often in terms of acts of service. But that was something as a child that I really wanted. And as her time was getting shorter and shorter, um, I came to the realization that she was really not capable of having the type of conversation that I wanted us to have. It was painful in many ways to come to that realization and to come to a point of acceptance of who she is as a mom, and um, knowing that there were certain things that I was never going to hear from her to tell me, but they are things that I could tell myself. I knew that there were certain things that she couldn't tell me as her illness got worse and she became weaker. Plus, her usual way of expressing emotion and love is not the same way that I wanted her to express love. A lot of journaling led me to this realization, and writing letters to love, which is just an exercise where I try to pull in the most loving version of the spirit within all of us in responding back to me. This is an exercise that came from Elizabeth Gilbert, who wrote for a number of books, and her Substack called Letters from Love. And some of those letters that I wrote to Love from myself, Love had answered that my mom, of course, has always loved me, and that her way of expressing love may be different from mine, but I need to get to a point where, as an adult, I can tell myself the things that I wish she could have told me, instead of waiting for her to be able to do something that she couldn't do even when she was healthy. Once I let go of those barely conscious expectations I had of our relationship, I felt like there was less pressure to have a certain conversation or have our time together spent in a certain way. And it was still painful to, of course, see her, because I think I felt like she was suffering, even though hospice did a great job of taking care of her symptoms. But she really wasn't functioning at a level that she wanted, for being so relatively young, at 66. And I think that's a lesson that could hopefully translate to all of you who are listening, is just trying to sort out when we really want another person to change, how much of that is just an exercise in futility versus changing ourselves and the way that we think to bring both peace to us and more peace to the relationship. And the last thing that that came through as part of my mom's illness was really just kind of how common conflicting emotions and wishes were there, on her part as the person who has serious illness. One part is, of course, a strong desire to not die, but the other part was a strong desire to not suffer. And at times, she vacillated widely between wanting to undergo experimental clinical trials, to wanting to die that same day, or wanting hospice to give her more pain medicine than they were really allowed to, which of course they couldn't. And it was difficult to hear how distraught she was. And it was difficult to navigate how I could support her in a way that was realistic to her experience, but honoring her wishes and the fact that she was dying and that she was suffering. I didn't have, well, I think not being the primary caregiver gave me some distance to be able to think through those conflicts, without living with her day to day. I think there are some upsides to being a long distance caregiver, but that emotional space was definitely helpful for me to hold both desires in the same frame of mind. I know that she had prepared and underwent a biopsy to prepare for a clinical trial in South Carolina that she really wanted to do. But as her cancer progressed, she really wasn't able to travel to South Carolina to get this experimental drug. However, they had made the drug already in preparation for her to potentially participate as part of compassionate use agreement laws in place. The clinical trial organizers were able to release this medication to my mom to use sort of as a last ditch effort. And I ended up, it was an injection, and I ended up giving it to her, even though I knew she was dying, because I think it made her feel a little bit more at peace that we had tried everything that was possible without having to travel to another place to get experimental therapies. Obviously, this is something that people without a medical background probably couldn't do, to get an experimental injection and then administer it to your loved one while they were on hospice. However, it was because I could hold both of her desire to try while accepting the fact that she was dying, because we all have a very strong desire to not die. Not sure that fully made sense, but it's two very strong desires that are concurrent, and I think most people probably jump between those two, to do or not to do something in multiple times a day, multiple times an hour, and that we're probably not as clear cut in terms of what we really want to do when it comes to a tough choice in someone's serious illness journey. It was a period of time that was very difficult for me, for our family, for my marriage, for my children, grieving not only for myself, but also helping my children, or my daughter more specifically, navigate her grief of losing her grandmother. That was something that I did not expect to be so painful. And of course, it was a way for my daughter and I to grieve together. But I think as her mother, I wanted to make sure that I'm there to support her in her grief for my mom, in a supportive way that as a child she certainly cannot support my grief. Those layers of grief are common, and for anyone who's a sandwich generation caregiver, that may be something that you're going through as well. And if so, just want to say I see you. I send my thoughts and love to you, because it's probably one of the most difficult things to do, to hold other people's grief at the same time as your own. So, from a update perspective, my mom was in hospice for less than 6 months, and she ended up passing away in inpatient hospice. I helped my dad and my brother explain the difference between hospice and palliative care, inpatient hospice and residential hospice, and what type of services were covered under hospice. For those of you who don't know, palliative care really treats symptoms without necessarily having a predicted life expectancy of less than 6 months. It can occur at the same time as curative therapy. So she could have had chemotherapy while at the same time seeing a palliative care doctor. We've always wanted her to see a palliative care doctor, but she never ended up getting to the palliative care outpatient appointment. When we decided on hospice, it was a joint family decision, and I think it was an escalation of her abdominal ascites, and that she was having a really difficult time getting the fluid and the pain and the distension under control, and was constantly going to emergency rooms because her fluid would build up either too fast to be accommodated in outpatient radiology by interventional radiology to drain, or it was building up too slowly where she would get to an interventional radiology appointment with the intent to drain her fluid and there not be enough fluid to drain. Even in a metropolitan area, it was difficult to navigate just the scheduling of these drainage procedures among multiple locations around the city. And that once she was able to enroll in hospice and have a drain placed in her belly, the hospice nurse was able to come whenever she needed the drain to drain off fluid, instead of having to constantly go to different emergency rooms overnight and waiting. Once she got to the point of being almost bedbound, or actually once she did get to the point of being bedbound, that was when we didn't know how long, but I was thinking that we were looking at potentially a couple of weeks. And my father was getting very tired in terms of 24 hours a day, 7 days a week of caregiving. We initially talked about going into a hospice house, a facility for care to give my dad a break. And that's what's considered residential hospice. Once people are enrolled in hospice, they can have a couple of days of respite so that the family can get a break, and that you can pay sort of for room and board for additional days if you need to. While she was initially in for residential or respite hospice, her symptoms worsened to the point that she needed very frequent pain medications and medicines administered by nursing staff. And so she was transitioned to inpatient hospice. And even with her being so sick that she qualified for inpatient hospice, it was still painful to watch and wait. She ended up being in a very almost dying state for an extraordinarily long time. Perhaps it felt extra long because we were waiting, but she had low blood pressures. The systolic, the top number being in the 60s, 50s for weeks. And she just wasn't ready. And we didn't know how long it would be. Even the day that she passed away, that morning, my dad had said that she looked about the same as the day before, which was about the same as the day before that. At that point, we had sort of taken shifts around the clock because I felt very strongly about her not dying without one of us being there. And I think perhaps she was able to finally let go when we got to a point where we couldn't physically continue to take turns overnight. And she passed away after my dad got there in the morning. And every time I went to see her, I thought it may be the last time I would see her until the next time I would see her again. And waiting for that to happen was painful. Just nothing I could do, or nothing any of us really could do, except to wait until the end. After she died, everything moved very quickly in terms of her funeral and arrangements, and it was partly a relief, but also I knew that I needed a lot more time to kind of process what had happened, and did not have the right frame of mind to be recording this podcast. So now that you have heard about what happened around August, or the preceding months to August, I hope you understand why the hiatus was so necessary. And it took some soul searching and careful thinking to think back as to whether I wanted to come back to record this podcast and keep it going, as I also have a day job and young children and all of the things that an adult need to do. But I really felt like I believe in what I'm trying to do here, in the sense that I feel very strongly that this information and this experience is something that so many of us are going through. And even though I don't get to talk to every single one of you, my hope is that with this season, we can have more bi-directional exchange of comments, whether you want to send those to my email or to text using the app, where there's a link at the bottom, the show notes, that allows you to send a text message. And for those of you who do end up sending a text message, just know that it's not an instantaneous notification to me. I will read through any messages that come through and respond either at the future episode or respond via email. For the text, it doesn't come through with your identifying information, except for the geography of where your cell phone is registered. So it might say a city in North Carolina is sending in this comment, but unless you include your specific information, I will not have an opportunity to respond back to you. But I do appreciate any feedback that you might have throughout these new episodes. And I hope that I'm creating episodes that are helpful to you and are validating your lived experience as an older adult, or particularly as a sandwich generation caregiver like myself. So I hope that season 5 of Ask Dr. Mia podcast is even better and stronger than previous seasons, because this return has been very intentional, and I am looking forward to hearing from you. Please send me a message using the text or the email at ask at miayangmd.com, which is my name, md.com, which is also the website. Thank you all, and talk to you next time.